Hey everyone, this is Miss Strat. We're going to be talking about the GI system. I don't look for this to be an hour and a half because I'm going to give you the most important aspects. I do want you to make sure that you print off and have in front of you your study guide, for this med-surg GI system, because everything on that study guide is on the exam. Okay, and so when I mention it, you need to highlight it, you need to take notes on it, and make sure that you review that. Okay, just some heads up. Eyes, this is spider angiomas, so dilated blood vessels, caput medusa, or just engorged blood vessels in the abdomen. Sometimes that can be from a liver disorder. And abdominal distension can be in infants, it can be in adults. So you definitely want to, measure that and document that. We're going to talk about tests. I told you this is going to go really fast. We're going to talk about some of the tests. Now, the tests that are on the study guide are the ones you need to know. Okay. There's others in here because they're all important. You may run across any of these tests that to be done in the hospital at any point in time for a GI disorder. But upper GI or small bowel series, if you've ever had one, it's like a swallow study or barium swallow study. It shows structural abnormalities. Okay, and you can go to these websites, pull them up, and it will give you some examples of this type test. My throat's getting scratchy. So this test diagnoses structural abnormalities in the esophagus, like tumors, strictures, varices, hiatal hernia. The lower GI, this is like a small bowel follow-through. They look for obstructions or fistula. It takes longer than about 6 hours for that to get through the GI, the GI system. It's performed like an upper GI. Then client drinks that barium. The barium can be very constipated, but it takes a long time for it to move through the GI system. Enterocolitis shows abnormalities of the small intestine. You need like an oral oropharyngeal G tube or an NG tube in order to put this barium down. And it goes to the jejunum, which is the small intestine. They're positioned on their side, and they have suction equipment available for the risk, because they have a risk of aspiration. And we're looking for abnormalities of the small intestine. And I believe, yeah, it really, that barium lights up the small intestine. You can see it really well on the slide. And then a barium enema, lower GI, looks at the colon, looks for polyps, tumors, inflammation. This barium can cause cramping, urgency. So you want to reassure the client, do some teaching, and you've got to do a prep. So the barium is instilled rectally. They look at the rectum, sigmoid colon, descending colon, and the client may have to change positions during this exam. They need to retain that barium for up to 30 minutes or for the entire test. Prep beforehand is 24 to 48 hours. They are on a low residue diet, 1 to 2 days before. They're on clear liquids the evening before and a laxative the evening before. And then they're MPO after midnight, and a cleansing enema the morning of. Oral medications are usually okay. Cholangiography. It's on your study guide. Cholangiography is performed to look at the patency of the ducts of the liver and gallbladder. Okay? It's performed to look at the patency of ducts of the liver and gallbladder. There's 4 types. You don't have to know, each type. RCP, IC, MRCP, and PTC. You can read them, in your textbook, but mainly just know that it's called cholangiography. ERCP I do believe I have that down here. Yeah, intraoperative cholangiography, or this is endoscopic retrograde cholangiography, ERCP. Okay, it's demonstrates the hepatic ducts, common hepatic duct, cystic duct, and common bile duct. And so it just visualizes the ducts of the liver and the gallbladder. Radionuclide imaging, also on your study guide. This test detects lesions of the liver or pancreas, assesses gastric emptying. You can look at the size, defects, bleeding, or for inflammation with this test. It's a radioactive, natural, or synthetic element that is injected or ingested. Then the radiologist examines the body organ by passing the imaging scanner over that particular structure. Pre-test, you need to weigh the client. Pregnant women are not allowed to take this particular test because of the radioactive material. Computed tomography, that's a CT scan. We know what CT scans are. They look for metastatic lesions, abnormalities. In this particular one, there's a left flank mass. I don't know if y'all can see it, but the client is usually NPO 6 to 8 hours prior, and they have a bowel cleanse. But CTs are sometimes an emergency, so they're just put in the CT scanner without being NPO. It's best since they're looking at the GI system, but it's not always ideal, And then an MRI, magnetic resonance imaging, where we're visualizing soft tissue, tumors, abscesses, bleeding. There again, they need to be NPO for 6 to 8 hours prior to the test. Have to remove all metal objects. And then a cardiology consult is for those that have a pacemaker, because it's usually contraindicated. And this is actually a MRI of a pet that has swallowed a car. one of those little cars that children play with. It's kind of neat. But the MRI really defines, all of these organs. Your CT, they usuly do first because they want to do the test that's the least expensive. I mean, it's all about the money, because your MRI is more expensive, but it is more definitive of the organs and what's going on. Ultrasound, you know what ultrasound is. It's high frequency sound waves that are directed through the body that bounce off nearby structures. Useful in detecting changes, sometimes in appendicitis. I know my son had to have, that's how they detected his was perforated, is through an ultrasound. You want to discourage chewing gum, drinking through a straw, or smoking. It causes a lot of air, in the GI system. And here there's something going on with the left kidney, nephrosis, I think that's what they said. The next one is a 76-year-old male with an 8mm lesion of the liver, which on my left you can see it. It's on and that the one on the left is with contrast. You can see it a little bit better. This is my last grandbaby, and you can see with ultrasound, that there's, you can tell, you can see the spinal column. I mean, I can make it out, and I'm not even a radiologist. Bone structure, and then of course ultrasound at 32 weeks is, this day and time is pretty amazing. You can make out the facial features. I thought that was just incredible. Percutaneous liver biopsy. It's on your study guide. Detects abnormalities, malignant changes, can detect infection, inflammatory processes, damage or cirrhosis, and any signs of liver rejection. So it's performed by obtaining a small core of the liver through a needle. It's directly into the client's lateral abdominal wall. It can be performed outpatient, but it requires sedation. So you'd have to have someone, they would have to have someone drive them and stay with them for 24 hours afterwards. They also get coagulation studies. Now, why does someone get coagulation studies for a percutaneous liver biopsy? Okay, what does the liver do? It contributes to blood coagulation. So they want to make sure that this client does not bleed out. So they have to do those PTT. Ultrasounds performed to identify the appropriate site for the placement of the biopsy needle. And they usually do receive a sedative and anesthetic. The most definitive test to confirm the diagnosis of cirrhosis is a percutaneous liver biopsy. Okay? This is what they do specifically to confirm the diagnosis of cirrhosis of the liver. In GI endoscopy, it's a direct visualization of the lumen of the GI tract. There are some dietary fluid restrictions. You have a bowel prep, anesthetic. You want to assess their vital signs, level of pain, any signs and symptoms of complications post endoscopy. Could be fever. They could have fever, abdominal distension, abdominal or chest pain. They could vomit blood, have bright red rectal bleeding. So they have to have a light food and fluid restriction. If the EGD is done, which we'll talk about, then they have to wait for the return of a gag reflex. So GI endoscopic procedures. Okay, let me do this. Esophagogastroduodenoscopy. Okay, it's called an EGD. You need to know this one. Okay, it's on your study guide. Examination of the esophagus, stomach, duodenum or duodenum through an endoscope. It's advanced orally to inspect, treat, or obtain specimens from any one or all of the upper GI structures. Okay? After the EGD, no food or fluids. They have to be restricted until their gag reflex, returns, because they numb, they numb that up down there on your throat, so your gag reflex is not present. You may have a sore throat too, which is a very common complaint. So know what your EGD, what the examination for your EGD is, where the examination is. These are endoscopic pictures. Let's see if I can click on that. If you'll go to this website, it's called Endoscopy Center. It has some in the classroom. This is actually the last slide. Okay. You need to know this Helicobacter pylori. It is a type of bacteria or organism that's believed to be responsible for the majority of peptic ulcers. And when we talk about peptic ulcers, we'll also talk about the H. pylori. The blood test shows antibodies to the H. pylori. It can also have a stool analysis that can show positive for H. pylori. This is a fragile bacteria that's found an ideal home in the protective mucus layer of the stomach. These bacteria have really long threads protruding from them that attach to the underlying stomach cells. The mucus layer that protects the stomach cells from acid also protects the H. pylori. So sometimes they're really hard-headed about treatment. They resist the treatment. These bacteria do not actually invade the stomach cells as certain other bacteria can, but it is an infection, however, and it's very real, and it does cause the body to react. Okay, so the main thing you need to know is that H. pylori is a type of bacteria that's believed to be responsible for the majority of peptic ulcers. And of course, it's treated, with antibiotics. And you want to go back and have antibodies checked to make sure, they're no longer an infection. And then there's my little puppy that's not so little. I should have downloaded his updated picture. Okay.